have Christina Bartis here. She works labor and delivery at Winnie Palmer.
Right.
How long have you worked there?
6 years.
Oh my goodness. What made you want to be a nurse?
Since I was small, I would watch PBS, anything medical, look at medical books, and then I knew that I wanted to do something medical. I don't know if it was a nurse, doctor, but definitely something to do with putting my hands on people.
That's good. And that was my next question. Were you interested in being a nurse when you were little? So yes, you were.
I think I always wanted to be something to do with delivering babies, obstetrician, but as I got older, I figured nursing suited me a little bit better.
Okay, how long have you been in school?
I started the nursing program, well, my credits towards my nursing program back in 1995 when I graduated high school. And then got married, so I had to stop school, and then I went back and spent a couple years. I did a year for my LPN, and then another year then for my RN. So it's been a culmination of quite a few years to just finish it.
Mm-hmm. Okay. Whenever you were in school, did you ever switch what you were gonna do?
No, never. Nope, always remained the same.
That's good. Did you work while you were in your nursing program in school and stuff?
For my LPN, when I got my LPN, I was not working. But when I did my RN program, I did work. I started full-time and then had to go part-time and then went down to 1 day a week with clinicals because it was just too much.
I hear that a lot, actually. There's a lot of people that don't work when they're getting
They
degrees.
encourage you not to work just because you have so many clinicals and they want you completely focused and they want you to pass that NCLEX on the first time. So they want all of, but in my case, I have to work. So I had to cut down a little bit, but continue my hours.
Well, that's good. At least you stuck with that. My next question was, are you an RN or LPN? You just said you finished your RN school.
I've been an LPN, and then I am transferring. I'll be taking my NCLEX here, hopefully within the next 1 to 2 weeks. And then I'll just transfer at my job and stay on the floor.
What do you do in the average day as a nurse?
On the average day, the LPN role at my job is taking care of assisting the RN with laboring moms. But once they deliver, they become my patient. Mom and baby become my patient. So I take care of them postpartumly, assess baby, take care of baby, medicate baby, that initial couple hours of life. If mom needs to be medicated either with antibiotics for whatever reason, pain medication, assessing her bleeding, just taking care of everything postpartum wise with mom and then with baby as well. Assessing any blood sugar issues that potentially baby has, all the above after delivery.
That's a lot.
It is a lot.
Oh my goodness.
And then we can get up to 4 patients, which means 4 moms and 4 babies. That would be 8 patients total.
Yeah. That's crazy. That's a lot.
It is.
Oh my goodness. What was the hardest class you took while getting your RN or LPN?
I don't know if it was a class, but just a section. For me, it's acid-base imbalance, metabolic acidosis, everything. All that is just because to me, chemically and all that, I don't like it. I understand it and I understand signs and symptoms, but it's just to me so abstract that to me I really had to buckle down and really figure out a way to memorize certain things just to keep it sane in my head. And then when I would get a question, to kind of break the question out and look at the values and whatnot. And even in LPN to R, it's still, for me, that acid base was one of the harder sections.
It's just hard to apply and understand.
For me, it was. And not so much hard, just making sure, because when they give you these questions or when you're learning it, it's not just the numbers, but also what your patient presents with. So, it's kind of all of that and just knowing what this should be and what that should be and the value should be and then what your patient looks like. It's all about what your patient looks like. So
it's never the same every time. It's always different.
It's always different and it's never textbook. A lot of times it's never textbook. So you have to use all that critical thinking that they teach you from the very beginning of foundations. Your very first nursing class, they're going to be foundations and they're going to teach you how to think critically and use what you know and go to from A to B to C and what it should be and what it looks like and what that does, you know. So, but that part for me, it's always been a little, ugh.
That does not sound fun at all.
No.
Are there any certification exams?
Yes, I think it has a lot to do with what floor you work on. So if you're on a med surg floor, if you're on a cardiac floor, if you're on whatever floor you end up working on, they have their own certifications. So for instance, the L&D's floor that I work on, everybody has to be ACLS. You, as a nurse, you're gonna get your ACLS, or even, you know, doctor or whatever. But ACLS, on our floor, we do all the labor stuff. So we have breastfeeding classes, we have certifications in reading the strips. You have to be certified in that. You can get your RNC. There's different certifications that then just elevate you to nurse 1, nurse 2, RN 1, and help with your pay, you know, grade, and just what you're capable of doing. There's certifications to doing certain procedures to moms, and when they're pregnant, you just can't do it. You have to have a class, pass that class, and then you're able to do certain things. So
Okay.
you have to, it's definitely floor-based, I think, depending where you're working.
Oh, okay. That makes sense, because they wouldn't want you learning labor and delivery if you're on cardiac or gastro.
Right, and cardiac, you have to be, you know, certified in tele, you have to be, there's certain things you have to be certified and learn those things, because if I went to a cardiac floor right now, I'd have to refresh everything, they'd have to train me, and I have to get certified in this, and certified in everything that hospital and that floor says I have to have before I could even go
anything.
on the floor.
Yeah.
I mean, you precept, you're gonna learn, but as you're doing all your in-house education, you have to do all that.
Oh, okay. So it's a lot, just depending on which one you're on.
Yeah, and just because you pass a test, their NCLEX, once you get a job, there's all the education on your floor. The learning hasn't ended. You're always going to be learning something new as they change policy, as new education's brought up, research. You know, there's a lot of research going on, and evidence-based research. You're going to learn that word, evidence-based, evidence-based. So it always changes, and as the companies and that certify, like JCO or A1 for us, things change, and so you have to get certified and all that, you know.
Makes sense.
Uh-huh.
What would you say is your favorite and least favorite part about being a nurse?
I love meeting the people. I love feeling like I potentially made a difference, especially in the fields I work in. They're coming in and they have new babies, and some people don't even have a clue what to do, and passing on that education and being sympathetic and empathetic and taking time. That's what I like, being able to do, and just once they leave feeling, okay, I gave them what I knew, and they move on. The least is that, you know, there's a lot of different personalities, and you have to learn, even though what your beliefs are, you have to still treat that patient, that person with the same respect, and that you would want, that you would treat that person that you believed everything they believed in. So you see all types of people, and there's certain things that you don't believe in, how they act, what they're doing, but yet you still have, and that's the part that, in a way, I don't like, because it sometimes puts you in a position you have to fight against your own beliefs.
Yeah.
But you know, it's what you have to do. It's one of those oaths that you take, is that you're going to take care of everybody the same and do no harm. But yeah, that sometimes is a struggle, especially when, you know something's wrong, but you still have to go ahead and treat that person as you would be treating anybody else.
You don't like what they're doing, like with their kid or how they're raising it or anything. And you
Or
can't
just
say anything.
example, I mean, we deal and I can only speak for how where I work, but we see moms and dads that, let's say, struggle for years to have babies, and they do everything to have a baby, everything, and that baby dies, and now they're at the hospital delivering a dead baby. And right next door, there could be a mom who has multiple kids, but's on crack, heroin, and these babies come out addicted, and they're just another baby that goes into society. As a human, just dealing with that, it takes a toll. And then I have to walk into that room with a mom that's just lost a baby and treat them the same way that I have to treat the drug addicted mom who's going to get up and leave her baby. We know that she's the same way, because I took an oath to tend to them, and I'm not tending to everything else, I'm tending to them. But sometimes as a human, that's
Yeah,
a hard part.
I can imagine that. That's terrible. I'm sure I'll have to do that no matter what healthcare I'm career in.
And you will come across because there's so many different walks of life on the earth. So you'll come across everything and still be shocked.
I am dreading that part of it. I don't know what I would do because I can't control.
You learn how to control your face. You learn how to control the look. You learn how to become almost a blank slate in a way at times when it needs to be, because you can't project your feeling onto that person in a way. You just have to sometimes just do your job.
Do you have any advice or tips for any classes, tests, or anything to do with really just being a nurse? Like things you wish people had told you?
Things, I don't know. I think a lot with nursing is time management. It sounds really corny and simple, but it's not. It's something you have to learn, and I don't think you really, maybe you can be told, but until you're actually on the floor, do you learn how to balance all your patients. They're all in different times of doing something. They all need be medicated. Who are you going to medicate first? Who are you going to tend to first? It's that whole priority, and I wish somebody would have said that's going to be the hardest. So just, when you hit the floor running, you got to really figure that one out. Until you figure it out, you just don't know. You feel like you're drowning there's still days when you know what you're doing and you still feel like you're drowning. So.
Do you ever get people that come in, like a baby that has something that you just don't know what it is or anything like that? You just don't know what to do. Nothing you're doing is working.
Yeah, but there's always protocol and people you can call. So there's always a lever. So if I get a baby, for instance, and the mom's a diabetic, and now the baby, I have to do a blood sugar because the mom's a diabetic. And everything that I'm doing to get that baby's sugar up isn't working. I'm warming up the baby. I'm feeding the baby. Baby's breastfed. I've given it a bottle, and yet so once I've exhausted all my ladder of things that I'm supposed to do, then there's somebody I call. Well, then guess what? I'm going to call the pediatrician and say, hey, this baby, I've done this, A, B, C, D, E. Everything that you would have wanted me to do and I have the ability to do and I have set orders to do that I don't have to call a doctor for. Now what do you want me to do? And then at that point, that's hers decision, what they want me to do. I take their orders and goes from there. But there's times where you get a bleeding mom in my case, and I'm like, I don't know what else to do anymore. But at that point, you call your charge nurse, you get extra hands, you call the docs, you let them, in my case, I've exhausted all of my parameters of everything that I could do to that mom without having to need orders. But there's always times where you're like, I don't know what to do next. I've done what I can do and I don't know. But there's always somebody else then you go to. Mm-hmm. So. As a nurse, even I would suspect with doctors, they can then always talk to another doctor and say, hey, what would you do? So.
Well, that's good. I don't have any more questions. Do you have any questions for me about schooling or anything or
So where are you at right now in your classes?
Right now, I'm in my first semester, so I'm taking just the general ed. Right now the class I'm doing this for is my new student experience class. It's actually really helpful. I thought it was going to be stupid. And it's actually showing me, we learn, our strengths based off psychology and what our talents are. And, my talents for, futuristic input, strategic, stuff like that. And it really just showed me, how I learn, how I can build on my strengths to help me better in schooling.
My only suggestion to you is just to keep going. Because there'll be points where you're like, this is too much. Nope, you keep going. Keep going. I love learning, and if you love it, you always learn, and you always, I always learn. Every day at work, there's something new. You never know it all. So it's definitely a field where you're constantly learning. So best of luck.
Thank you.
You're welcome.